My name is Paul. I'm with Cutera. We're the manufacturer of truSculpt 3D. And this is something that we like to do for not all of our practices, for some of them. Dr. Vanek is somebody that we're going to have speak about this product for us for just for many purposes because of his knowledge within body sculpting in general. And obviously this is a technology that's different from what else is out there. And we'll kind of go over that. And if you have questions throughout, please, go ahead and feel free to ask, throughout. We don't have to wait till the end. This is not like school. Don't wait till the end. If you have a question, just feel free to ask, okay? So, obviously, if there was some way to do all of this without there being any downtime or surgery, it'd be ideal, right? So, the nice thing about truSculpt 3D is that's one of the biggest things about it. There's no downtime. It's the world's first body contouring device that has the ability to treat your full core area in an hour. And it utilizes radio frequency. Radio frequency's initial indication, or what it was originally used for, was for skin tightening. So one of the only side effect that we really have from this treatment is a cinching up, and you'll see that when we get to the before and afters. If you're familiar with Real Self, it's actually something that's in our industry, in the aesthetic, cosmetic, and surgical industry. It's a patient-driven website that is only influenced by reviews of patients. There's no companies marketing-wise that can influence it or practices that can influence it. And truSculpt 3D has the highest worth it rating, is how they rate things as far as non-invasive procedures go. Again, you can treat multiple areas in one session, in one full session, which is an hour. And there's no downtime, which is super nice. This is a little bit of a marketing video that I think the volume is on here. I want to make sure the marketing department gets their kudos here. Plus, this kind of gets us in like a funky mood, So it kind of gives you an idea. You'll see a graphic here that kind of gives you an idea what happens during the treatment. So this is what the handpiece looks like as it goes over the body, and it's delivering that energy into the fat, which then destroys the fat. And this treatment was designed with the comfort being in mind. So of all the non-invasive treatments there are, this is the most comfortable and it's the most efficacious, and we'll explain how and why. And we're going to look at a lot more before and afters. So that's one that I will talk about a little bit more in depth in particular. Everybody really ready to go to the club now? Are you excited? All right. So truSculpt 3D, basically how it works is if you look here, it's going to damage up to 24% on average of the fat cells. Everyone else can only say up to 22 or up to 24%. So the fat cells are brought up to temperatures, and you'll see here basically what happens is they get eliminated in the following weeks. The body naturally eliminates them through the lymphatic system. It takes 6 weeks for the body to get rid of those dead fat cells and up to 12 weeks for you to see your full results. One of the biggest things that we hear about, this is with liposuction or with non-invasive fat destruction like this treatment in particular. People are always like, well, where does the fat go? I heard it's going to go somewhere else. Well, our problem areas that we have, if you look back on one side of your family or the other, you can thank your ancestors for this. Most women on one side of the family or other, you relate to carrying your weight in the same areas if you have problem areas. So our problem areas, actually, we just have a genetic predisposition of having more fat cells there. When we gain and lose weight, we gain and lose weight evenly amongst our fat cells. The reason why we notice it in our problem areas is we just have more fat cells there. So there's all these treatments there's diets and fads and exercise programs that claim to spot reduce. The only way to truly spot reduce is with a treatment like this or liposuction. It's not a weight loss treatment. It's a fat destruction treatment. So you don't necessarily have to change your diet and exercise to get a result. Like if you do those things, you'll get an exponential result, but you can if you're taking in, 2,800 calories a day and you maintain that, then you're still going to get a result. It doesn't matter. It's going to give you that reduction no matter what. So what the treatment consists of is, obviously one of the things that we're doing tonight is a free consultation, which is a nice thing, to kind of give you an idea of what it would look like, what areas would, that bother you and what the cost would be, because there's a massive reduction in the cost tonight. So the first thing that happens is marking, and they don't use permanent marker on you. This is just for video. And we want to try to find the apex of the fat pocket, basically. So by finding the apex, we can put an X on that area and then align the template where the fat pocket lives. I mean, I read somewhere that the only person that has a symmetrical face is Denzel Washington. So we're all asymmetrical, right? Our fat, even if we have like problem areas in our love handles, they're not necessarily identical. The fat pocket may be at a different angle here or the other. So we're going to identify where the apex is and then line it up with different size templates to make sure that we're getting the right area. We'll fast forward through this because there's something that we want to look at here. So this is basically how the treatment is. This is as much pressure that is on the skin at any time. And it's just, the areas are designed to be optimized for surface area as well as making sure that we maintain optimal temperatures comfortably. You'll see here that one of the biggest differences in this technology is the uniformity. So I'm sure you've heard of cool sculpting. I mean, cool sculpting works. We just have a 10 times better mousetrap now. One of the things that is different between this and cool sculpting, one is the time, two is the cost to you, three is the comfort, and four is the consistency. So some people don't have enough fat for cool sculpting. Some people have too much fat for cool sculpting. Some people have too lax a skin for cool sculpting. So there's a lot of people that are buying this device now that are still offering cool sculpting because they know how many patients they've had to turn away. It's not something that's readily advertised because so many people have the device. Why would they want that to get out there? And it works. It's just there's a lot of contraindications with the device. If you think about it, using thermal versus freezing, our natural body temperature is 98.6, right? So we're only going to about 114, 116 degrees in the fat when we're treating. You're going from 98.6 down to 32 degrees. That's a huge delta. That's more trauma on the body. So there is no side effects with this. With cryolipolysis, which is what cool sculpting is, there's late onset pain, there's numbness, there's shelving or what we call shark biting that can occur where there's an indentation where you had your treatment. And then there's a more rare condition, but it's not that rare, called reverse adipose hyperplasia, which basically means that the area gets larger, and the only cure for that is liposuction because of the whole sucking and freezing process. With this being thermal, and with RF's initial indication being for skin tightening, there is a cinching up that occurs because we're at 44 degrees on the skin, but we're at 46 degrees in the fat. That's what makes it more comfortable. That was one of the big game changers, that in the way that the actual device works. So when the treatment starts, you'll feel like a warming sensation. It's kind of like, stepping into a hot tub. We've got to bring everything up to temperature. Then if you've ever had like a hot stone massage, when you first put those stones on, that's how it feels. There's actually like kind of like a soothing sound, that spa-y sound that plays through the machine. We've had, during clinical trials, we had people fall asleep during the treatment. So it's extremely tolerable, and you'll feel this warmth throughout in each one of the 15-minute areas, and we would consider a full treatment an hour, which would be 4 15-minute areas. So for example, like lower abdomen, upper abdomen, left and right love handle, that would be a full treatment. Each one of those is broken down into 5-minute segments, so that it's just how the treatment works. So since there's no downtime, you can do whatever you want afterwards. Basically, you go to an event like this, you can go to the gym, go to work, you can go back to work, you'll pick up the kids, go on vacation. I've done all of these things except for go on vacation because I've been super busy for the last 18 months, so I haven't had any time to do that. Till next week, finally. So we mentioned this earlier. You can see your results as soon as 6 weeks because it takes the lymphatic system. Just by going to the bathroom is how we get rid of the dead fat cells. So if you think about the lymphocytes as little Pac-Man, like when there's a dead fat cell in the system, the brain sends it out to eat them up, and then you just get rid of them by going to the bathroom. And then you'll see your optimum results by 12 weeks because it's got to settle back in, and there's the cinching up and things that occur. So we say up to an average of 24%. People can get more than that. That's why with the easiest way to think about it is you'll lose a full pant size in one treatment. When I got my treatment done, well, first I was freaking out because I'm looking in the mirror like this, and I'm looking at my wife. I'm going, honey, I'm not seeing anything. I got to talk about this, you know. But it taught me to be how it was in your shoes, right? So like the hardest thing for us to do, one, is when we look at ourselves in the mirror, is you don't get your whole body treated. I just got this area treated. So the hardest thing to do is just look like that in your mirror because you're only looking at that area. It's gradual. You're not going to notice it, you know, day by day. Where I noticed the biggest difference, I was disciplined enough not to look at my before, and then I looked at my after. I totally saw a difference. But where I noticed the biggest difference was right before I went out to go support a customer at an event. I went to put a black suit on that I hadn't worn in a while, and it fit. It wasn't loose. It fit before, but I went to put the pants on, and they were like awkwardly bunchy in the crotch area after I put the belt on. And I'm ashamed to admit I haven't worked out in 18 months either because I've just been on the road, and I have horrible habits. I work all day and I eat at night, you know, and it's the worst thing I do. I know I'm in this business, but I lost a full pant size just from the treatment. And where the biggest tell-all for me was during this past season we just came through. From Thanksgiving till like, you know, New Year's, like January, we've all gotten together and found any excuse we can have to drink and eat with friends and family, right? So we're less active. If we fluctuate in weight, this is when we tend to have a little bit of extra weight on. I gained like 5 pounds during that season, but I didn't gain any inches back in my waist. So if you think about it, like we talked about, you know, if you treat this area, you're destroying the fat cells. So you would have to gain a significant amount of weight across your whole body to get that same pant size back because we're destroying that area. So I gained 5 pounds and I didn't gain any inches in my waist, which was nice because I just bought a lot of pants that were from a 34 to a 32. So if you look at this is a clinical photo. Right here, this is ultrasound of the fat layer. So there was a 35% reduction in one treatment, and this was the template design that was used for this particular patient. Now this patient, normally when this person walks in, and this is not somebody that we would always say is ideal for this treatment, but it works, right? So like anytime you walk into a plastic surgeon's office, typically they're going to say liposuction tummy tuck because of all the lax skin. But what you can see is this really speaks to the cinching up effect, right? There was more lax skin here than there was fat. That's why she got a 21% reduction in the fat. But you can see there was already hangover in the before, and the cinch up is occurring, and then the overall skin quality was improved as well. So this really speaks to that whole tightening effect that occurs on top of the reduction of the mass, which nobody else can offer. The other thing that really makes this consistent, let me just speak to why the technology and how it works, because you can take a look at this later, because I put the device in service mode to kind of give you a peek behind the curtain of what's going on while the treatment's going on. There's 3 thermistors in the handpiece that are taking real-time temperature calculations at all times. So when you're moving the handpiece, it's making sure that we're at the desired temperature that's set, and it's adjusting the energy to deliver or not deliver energy to make sure we maintain that temperature. Every other device just has a setting and that's it. With subcutaneous fat, we have white fat, yellow fat, beige fat, and fibrous fat. All of these different kinds of fat require different amounts of energy to get to destruction temperatures, especially fibrous fat. That's why there's inconsistency in the other treatments, because if it's not the ideal type of fat in that setting, it's not necessarily always going to work. You might get some reduction, but not all. We're guaranteed to get to temperature with this because of that real-time feedback. That's one of the biggest differences in why this is consistent. This particular patient, she complained that this flank right here stuck out further than this one. So we talked about that Denzel Washington face, right? She wanted to be symmetrical. So because of the way we were able to align the template, she got a 29% reduction on this side and a 24% reduction on this side, giving her a more uniform look on her body. Every time I show this photo, everyone's like, I just want to look like the girl on the left, right? This is the before photo. Now, again, it's all relative, right? So what this basically shows is that no matter what, you're still going to get that up to an average of 24%. She still got a 24% reduction in the thickness of her fat layer, even though there wasn't maybe as much there. It's going to be 24% of what's there, right?
Can I ask a question?
Mm-hmm.
Was that only after 1 hour?
One treatment, yeah, 1 hour. If you can see here, there's like a superimposed. They did this one a little different. This patient gained 2 pounds and still lost 29%. And you'll see like a back image here too. So you can see the outline. So again, getting the treatment doesn't mean you can go on like a buffet tour afterwards, but you definitely don't have to change your lifestyle tremendously to get a result from the treatment. It's science. It just works. This particular patient actually got a second treatment, which I can't wait to see their photos. But if you look, this person gained or lost 0 weight, and it looks as though having their stomach and flanks treated as if they lost like 10 or 15 pounds, right? But they didn't gain or lose any weight. It's just destroying the fat. So your overall, body fat percentage doesn't really change. It just gets rid of the problem area. This is actually a patient from a doctor that's in like Northern Ohio. This is a customer photo. Those were all clinical photos before. This lady, she was a mother of 3, 58. She walked 3 times a week, but didn't really go to the gym a whole lot. Ate somewhat healthy, not like, didn't always concentrate on healthy eating, but didn't overindulge or overeat. But one of the things for her that she always complained about was that she had a boy's body. She felt like she was straight up and down her whole life. So what this doctor did was she treated the flanks up a little bit higher, and you can see this area is improved, but there's more of an accentuated curve now. So this is, really get the body sculpt here. Like for me, for example, when I got my treatment done, my lower abdomen stuck out further than my upper abdomen. But I definitely needed to get a treatment on my upper abdomen too. So what we did was I treated my lower area first to make sure it got even with this area, and then I can address this area now, right? So you really can contour it the way you want. It's for men too. It's harder to see with this one the way the customer provided it, but he's a little bit wider on this side, and then there's a lot more definition in this area. He definitely has a funky belly button, but you can see a lot more definition here, so I think he got 29%, even though he's fairly fit. And one of the things that's really cool about this treatment is that when you do your consultation, a lot of times women will tell me that the bra area where there's a crease is a bothersome area for them. We can definitely treat that. But a lot of times what happens is it might make more sense to actually get your core area done first, because if you notice here, there's a little bit of like poochiness here, and he never got that addressed. But because he treated his flanks and his abdomen, it improved here because of this. This is the one time gravity is our friend. It doesn't suck, right? So there's a cinching up that occurs from the treatment regularly. So it might be something that you identify as a problem area that you could get treated later, but go ahead and get the core done and see if that area gets addressed to your liking. You might be able to save money and not have to do that,
I have a question.
Sure.
Can you treat other areas like arms?
You can treat from the neck down. You can do arms, thighs. One of the things that our physicians, we're going to see submental next. So one of the things that a lot of our physicians swear by is for cellulite. Because if you think about it, cellulite's a condition where you've got shorter fibrous strep mixed in with regular length ones. So what fibrous strep are basically little strings of skin that connect in between the fat and the skin. So if you think about it, with cellulite, there's the shorter ones that create that valley, and then there's a herniated fat. Then the fat cells are herniated on each side, right? So in the valley of where the cellulite, the valley is, there's very little fat in comparison to where the herniations are of the peaks where the fat cell is. We're not doing anything to address the fibrous strep, which is you can break those up to make them grow a little bit longer, but they never grow back as long as regular ones. But by just addressing the peaks of the fat, there's much more fat there than there is in the valleys. So if you shallow the peaks, you're gonna, if you reduce the peaks, you're gonna shallow the valley. So, and it's more fibrous fat. So it takes a little bit more of this is the only treatment that can address that fat like that. There's no cure, quote unquote cure for cellulite, but you can reduce the appearance of it. And then arms, a lot of people will complain about, in our industry, we call them bat wings, where basically the best way to treat those is you hold the arm out and you look for the lowest dip, and that's where depending on how you do it, you go across like this or you do lengthwise. So it will destroy it. The biggest thing during a consultation is determine the fat to skin ratio there. If there'll be an improvement, but if it's a lot more loose skin versus fat, it's not going to be as noticeable versus a decent mix, right? Submental. So this is done in packages of 3. These are just results after 1 to show what happens after 1. So you can see here, there's a little bit more poochiness to the skin. There's a less definition to her jawline. The submental treatment, to do it correctly, you want to treat under here, but you also want to get here. One of the things that a lot of people will combine this with is fillers. because with a youthful female face, you look at it typically as a triangle that's like this, right? And this is where gravity's not our friend, where that triangle tends to flip upside down, right? So we start to gain, we get jowling and we lose, volume. So by debulking here and adding filler here, you can give turn that triangle back upside down, right? So, but this is the first start, because this is also going to address the skin and the fat. It's done in series of 3. If you were going to get the same area treated on the body, again, you would wait 12 weeks for that. With this treatment, you can do it every 4 weeks. So you get your package of 3 done within 3 months. This is, again, this area here. Now it's gone. This lady, I remember speaking with her. She said no matter how long she can remember back, even when she was in her 20s, she had this right here. She had that. And after one treatment, it's drastically reduced, and you can start to see the definition in her jawline. So again, this is from the neck down. You don't want to do anything on the face. We've even treated what is called moobs or man boobs, where there's fattier areas in the breast for men. Some women have actually wanted there to be like more of a contour between their leg and where their buttocks is. So there's different ways to contour that way. Inner and outer thighs are very popular treatment. I treated my mom, and she called it her menopause fat on her knees. She said, I never used to have a problem with the fat on my knees until I went through menopause, and I couldn't get rid of it. So we treated her knees, and it went away. So it was nice that her son was in the industry,